I am Melissa Anderson. I'm going to be doing my assessment on my son Jacob. I'll get started. Before I go in, my MA will have gone in, done vitals, done a hearing test, and done a vision test for me. So I'm going to walk in. Are you here for your wellness? A well check? What is your name?
Jacob.
What's your birthday?
November 9th.
And do you know what today is?
Sunday.
Okay. So he's alert and oriented. He's appropriate behavior. So we're going to start off with the head. So I'm going to assess his head, check for any lacerations, any masses, any injury that could be done. Pain?
No.
No pain reported upon palpation of the head. His hair is intact. It's clean. There's no infestation. So I'm going to move down to his face. So I'm going to check his trigeminal nerve, cranial nerve 5, and his facial nerve 7. So clench your jaw. Okay. Go side to side. Okay. No pain. There's no pain, no popping at that jaw. Raise your eyebrows. Smile. Puff your cheeks out. Okay, don't let me push out. Okay, both of those cranial nerves 5 and 7 are intact. His face is symmetric. There is no lacerations, no abnormalities in skin tone, everything is intact. His eyes, so I'm going to look at him. His eyelashes, top curve up, bottom curve down. His conjunctivi are pink, moist. His lacrimal ducts, palpating them, there's no drainage, no pain, no tenderness noted, right? Okay. I'm going to look at his eyes. They're both round, equal, brisk, reactive to light. Check for accommodation. Okay, he is able to accommodate. I'm going to check cranial nerves 3, 4, and 6, which is going to check his gaze. So follow my finger. Okay, that cranial nerve is intact as well. I'm going to take my fundoscope and do assessment on that. Okay, so look at my shoulder.
The vessels and the optic nerve are visualized
Alright, optic nerve and visual and vessels are assessed in that eye as well. So his nose, I'm going to check his bridge, hard and soft, for any masses, any abnormalities, any tenderness. There is none. At this time, I would also ask him if he's had any issues with smell. If you're having trouble smelling. No, if he were to say he was, I could take different oils or a lemon or something and check his sense of smell. But they're reported as normal. I'm going to check his nasal passages and make sure they're patent and the membranes are in the okay. Nasal patches are patent, dry. Okay, can you smile? Mouth is symmetric. Open your mouth. And I'm going to check his vagus nerve and his hypoglossal nerve, which is 9 and 10. So go ah. Stick your tongue out. Tongue is midline. Tonsils are not noticed. They have been removed. His hard palate is fused. His soft palate is moist, pink. There is no obvious dental work needed. And his ears are next. I'm going to feel for any masses, They are symmetrical. They're equal to the outer cavernous of the eye. And like I said before, his hearing was done by the MA before I came into the room. So I'm going to assess.
So, the ear canal does have some wax, some redness. His tympanic membrane is pearly gray with the light cone at 7. On this side, I'm going to pull down and back. His canal does have some ear wax as well. His tympanic membrane is pearly gray, and the cone of light is at 5 o'clock.
So now we're going to check his neck. So we're going to look at if it's symmetrical, there's no abnormalities in skin tone, any noticeable masses. His trachea is midline. Can you do side to side, up and down, all around? His range of motion, his neck is intact. I'm going to come back behind him and I'm going to palpate his thyroid. So I'm going to have you swallow. Okay. Could not feel his thyroid, which is not a negative thing. Thyroid assessment is intact. Now I'm going to check his lymph nodes. I'm going to check his anterior, his posterior, his submandibular, and his submental. All lymph nodes have no masses, no nodules that are felt, so they are intact. And now to check his shoulders, I'm going to look, make sure they're symmetrical. The scapulas are both intact and symmetric. So I'm going to check his cranial nerve 11, which is a spinal accessory. So shrug your shoulders up. Don't let me push it down. Cranial nerve 11 is intact. So now we're going to check his range of motion in the shoulders. So I'll have you go forward and up, down, back, in, and out to the side, and down. Range of motion is intact. Now I'm going to check and assess his chromium process. Check his elbows, his wrists, fingers, and his capillary refills are less than 3. Do the same on this side. Assess chromium process, elbow, wrist, fingers, capillary refills is less than 3. So we're going to do range of motion on your elbows and your hands, okay? So straight out. Okay, now your wrists, fingers. Okay, range of motion on his upper extremities is intact. Now we're going to do deep tendon reflexes. So you're going to just relax your arm. Check his bicep. Okay. Brachioradialis. Okay. Reflexes are 2 on that side, which is normal. So this side we're gonna. Okay. Reflexes on this arm are also 2, which is within normal. So now I'm going to assess his chest. So I'm going to do his back first. So I'm going to look, make sure there's no skin abnormalities, no masses, no lesions, no any skin irritation or anything. That is normal. So I'm going to auscultate his lung sounds. And I'm going to go in a lateral pattern. So when I move the stethoscope, take a deep breath. Okay, lung sounds are clear, no abnormalities. All fields are clear. I'm going to check his chest expansion, so taking a nice deep breath. Lung expansion is symmetrical. His AP diameter is 2 to 1. Now I'm gonna percuss. Just ignore it, just ignore it. So I'm gonna percuss. Its resonance throughout all lung fields. And now I'm gonna check his vocal frematus. So when I listen and move the stethoscope, I want you to say 69, okay?
99, 99, 99, 99, 99.
Okay. All sounds were muffled from top to bottom. Please stop it, dude. You're gonna get me in trouble. Now we're gonna do the tactile. So say 99 as I move down.
99, 99, 99, 99, 99.
Okay, vibration would decrease as I went down his back. Everything was normal. So now I'm gonna move to the front. I'm gonna listen to his lung sounds. Just big deep breath. Okay. Okay, while I'm listening, I'm also going to listen to his carotids, palpating each one first. Okay, there is no bruit present. Okay, now listen to his heart sounds. Please stop. Okay, heart sounds are normal with S1, S2, no murmurs or extra beats heard. So while he's sitting up, I'm going to palpate for his apical pulse. Okay, that is all intact. Pulse is regular. No skip beats, no extra beats. S1, S2 present. So go ahead and lay back. So now that he's laying back, I'm going to assess and see if there's any jugular vein distension. There is not. While he's laying down, I'm going to listen to his heart sounds again, and then I'm going to listen to all 4 quadrants of his abdomen. Okay, S1, S2 noted, no murmurs as well. Listening to all 4 quadrants. Okay, bowel sounds are active. Now I'm going to listen to his aorta, his iliac crest vessels, and his femoral. Okay, so now I'm going to percuss his abdominal area. Okay, that's resonant in all areas of the abdominal area. Now I'm going to do light touch in a circular motion, checking for any masses, any abnormal sensation or pain, anything. Okay, now I'm going to check McBurney's point, which is in the right lower quadrant, just anterior of the iliac crest. And it's going to be a rebound test. Any pain? Okay, now I'm going to assess for the liver. So I'm going to start at the top until I feel a hear dull percussion, mark it right there and start down below. Do the same thing. Okay, and about there. Measure the area and make sure it was within acceptable measurement. Palpate it, liver. Okay, and then the spleen is over in the upper right. Okay, now we're going to palpate the kidneys, which is a deep palpation. Okay, abdominal assessment is done. Now I'm going to check his hips. So I'm going to... Any pain? Okay, now I'm going to check range of motion. So I'm going to take it, bend your leg. Pain? Do this leg. Just bend. Size of popping, no pain? Okay. Go ahead and sit up. Scoot back a little bit. Okay. Now I'm going to do his lower extremities. So I'm going to assess his legs. There's no abnormalities, no lesions, no swelling of his hands or feet. His toes and his toenails are kept. Can you feel any touching you? Okay, so he has sensation in both extremities all the way down. Can you turn this a little bit? So I want you to extend your knees out. Okay, do this one. Okay, now flex, pump your feet up and down. Move along. Any pain? No? Okay. So now I'm going to check your reflexes. So relax your legs, just relax. Okay, now I'm going to do Achilles, both sides. Okay, now the plantar. Okay, all reflexes in the lower extremities are intact. There is no abnormalities noted. All the joints feel fine on palpation. Okay, so stand up. Please. Okay. There we go. Okay, so what I want you to do is close your eyes. Hold your arms out. We're going to check the Romberg test. Any dizziness or anything? No? Okay, put your arms down. So Romberg test was negative. So what I want you to do is walk there and back. Okay, come back. Okay, now I want you to do foot to toe, right in front of each other, heel toe. Okay, what I'm doing when he is walking back and forth, I'm checking for balance, coordination, which is all intact for him. Okay, now I'm going to, so now I'm going to check his spine. So what I want you to do is go like you're going to go diving in a pool. Okay, now I want you to, so I'm feeling his muscles, looking for any abnormalities, his spine while he's standing straight up. Okay, now I want you to bend forward and touch your toes. So as he's doing that, I'm checking his spine to make sure it's straight. It is straight. He's able to bend without pain. Go ahead and stand up. Okay, now I want you to go side to side. Side to side. Okay, then I want you to turn, range of motion, sideways. Okay, he's got good range of motion, no abnormalities in his spine, palpation, and assessment. There is no masses found, no abnormalities. Spine is intact, spine is straight, able to move freely without any pain. Okay, come up here and sit down. Oh wait, stand up once. So we're going to test for dystaxia. So go ahead and take one heel and go up and down your spine, up and down your shin. Okay, so this dystaxia test is normal. Let's go ahead and sit down. Okay, so now I would go on to the neuro exam for him. And with this, I would check for proprioception, I can't say the word. I would check to see if he has a sense of touch, so if he can tell differences between temperature and textures. So I would take some hot and cold, touch him on different extremities of his arms or his legs, and then make sure he could tell the differences between hot and cold. Then I would take a cotton ball and a sharp object, and I would test again on each extremity to see if he could tell which extremity I'm touching and whether it's soft or hard, or soft or sharp. Then I would check his proprioceptive, and that would be looking at the position of a body part. So I would have him close his eyes. I would take a finger and I would raise it up on one hand, and I would hope that he could tell me which finger was pointing up. The other neuro test we would do would test corticosensation, which is being able to identify an object. So to test that, I would put an object in each hand, and he should be able to identify what that object is, whether it be a key in one hand or a quarter in another hand, coin in another hand. He should be able to tell me the differences in those objects. Otherwise, I think this concludes my head-to-toe assessment on Jacob.